Hello, my name is Dr. Zainab Aboud. I'm one of the consultant anaesthetists and I work at Imperial College Healthcare NHS in London. Today I'll be talking to you about simulation in medical education and anaesthesia. What we'll be talking in the next 15 minutes is looking at simulation, the benefits, different types, also setting the standards globally as well as what's in the UK. And also the simulation in anaesthesia as training professional. So we know that simulation-based education and training has a crucial role in improving quality of care of patients and increase safety. Its focus could be on technical, clinical, or even non-technical human factors at different situations. It's important to determine first the objectives of the simulation, and then can integrate it into the curriculum of the training. Our different speciality could be anaesthetic, could be medical training, and even surgical. Looking at benefits from simulation, and there's evidence base for it for different studies. It can be bespoke to target individual, team, or organizational development needs. It can help learning with emergency drills in a safe environment. It can help also with learning on uncommon scenarios in a safe environment and share the common learning outcome. Also, simulation activities can be designed to create a stress test that test the local guidelines or the emergency preparation of different organizations. We know that different types of simulations serve different purposes. So we have the low fidelity one that's, for example, the part of the body task trainer, such as cannulation. There's the procedure trainer, such as intubation for if we have a mannequin as a head, or we can have a full body but low fidelity, such as CPR, chest compression. We have also the high fidelity, the full body mannequin, and is the interactive one attached to monitors. They can move, you can listen to the heart sound and chest and so forth. And nowadays as well with the technology, we have the immersive learning technology, the virtual reality, which gives a three-dimensional and more computer-generated simulation that gives you the reality kind of in situ feeling of the environment in the ward or in theatre. We also have the mixed reality ones, which merges between the two virtual and real world. And this is more for advanced training, really. More and more common in London, especially in our hospitals, we try and get the simulation in situ, which is bringing the mannequin and the actual situation in our working environment. So we do simulation in theatres, we do simulation on the ward, where it's actually working as a multidisciplinary team, and this is more effective, as proven. Also, we could use simulation with actors or role playing to improve communication skills or feedback or debrief. Now, one of the important aspects of simulation is setting the standards, and where do we get these standards and how can we improve the standards that we're doing. 10 years ago when we started, it was basically a gradual improvement, but nowadays we have many resources that we can improve the standards and make it really designed to improve the outcome in every aspect of patient safety. So in England and UK, we often look at the Association for Simulated Practice in Healthcare. We also look at the global consensus statement that was produced last year. And in anaesthetics specifically, we have the Royal College of Anaesthetists Simulation Advisory Group, which has a great resources for the training and also for anaesthetic in general. And also we'll be looking at other resources later on in the talk. If we look at the Association for Simulated Practice in Healthcare, it's a not-for-profit membership association in the UK comprising members from all around healthcare, education, patient safety backgrounds. So it could be doctors, nurses, managers. It's established in 2008 And their mission was to promote, support simulation-based education and technology-enhanced learning to provide the best practice for our patients, learners, and partners. The main goal for them is to safety, equity and diversity and inclusion in their training, sustainability, and excellence. They have different advisory groups and subcategories. Some of them look at the pediatrics, some of them look at maternity, simulation, the debriefing and how to make it more excellent, and simulation research. There's also a simulation group in the primary care with like GP. We have also a sustainability group. So they're all working together in subgroups, but they come to make the simulation experience more enhanced and provide the best exemplary practice that we can lead on. They've also set the standards for 2023. They produced their guidelines. So in simulation centres around the UK, especially in our hospital and another hospital, Chelsea and Westminster, we follow these guidelines and the standards, and we try to abide by it to improve and reflect and provide the best simulation. They have a 5-year vision. And so from 2018 to 2023, they had these 4 or 5 points that they wanted to start with, and include safety, promote patient safety, inform national policies so the healthcare workforce development can all kind of follow. They're trying to standardize it and make it easier for each institute to follow if they want to set up their own simulation. They are currently working on their next 5-year vision for 2024-2029, and they also have annual conference coming up in November in Bournemouth. So it would be great to see many of you attending that. We also, I'll be looking at the global consensus standard that was produced last year, and this one is an international collaborative effort. That was a consultation process was conducted over 50 societies operating over 67 countries within 6 continents. And the aim of it is to have a look at the healthcare challenges for simulation and how can each one produce the best practice despite these challenges, and we can learn and share from each other to make simulation is more practical and applicable. So it also established a consensus on key priorities for everyone to try and follow to provide the best simulation practice that benefits patients. This consensus has been endorsed by the Association of Simulation in the UK and also by the Society of Simulation in Europe. This consensus has published key recommendations and call for actions that all we should be following. I won't go into details about it, we can read it, but the 2 points that I would like to highlight is the benefits of simulation. The key recommendation was to emphasize the key benefits for simulation for everyone, patients, staff, and organization, and also the low cost, high impact simulation methods that could really benefit everyone. The call for action, again, there's many points, but I will emphasize on the part everyone should be a champion for healthcare simulation in their own institute and try and embed it and try and push for it. So it's a standard thing that we should be doing on day in, day out. Also, part of the setting the standard, there's a collaborative work that is being produced. It's improving quality through simulation. And this document has been produced by the Health Education Improvement in Wales, the Association for Simulation Practice in Healthcare, and the Society for Simulation in Europe. So this is a very powerful document that can set the standard and help also to follow and improve simulation setting in anywhere and make it really powerful. I'm going to touch upon now simulation in anesthesia, because that's what our speciality. Simulation is not only for the trainees, it's for anaesthetist consultant, junior consultant, senior consultant, and for their team as well in theatres. Resources we often follow is the Royal College of Anaesthetists simulation. It's abundance of resources which I'm going to go into. The Association AAGBI, Association of Anaesthetists, Great Britain and Ireland, quick reference handbook. It has a great anaesthetic emergency guide, which can be easily incorporated into simulation scenarios. and practice on. We have the Difficult Airway Society, DAS, and the Royal College of Anaesthetists airway teaching material for novice anaesthetists. It's a very rich and powerful material. Gloucester Hospitals, they created the 5-minute flashcards, which is a very practical, easy to remember, and in simulation, you can easily drill it into a daily practice thing. Also, we have Life in the Fast Lane in situ simulation, which is very good because it brings the simulation back in the environment of the anaesthetist, and also can incorporate the other team members, such as the theatre assistant, theatre staff, the surgeon as well. And this is even more powerful because it's the whole team practicing together. We have also the Faculty of Intensive Care Medicine simulation scenarios. Again, they're video scenarios and written scenarios, and they're very, very powerful scenarios that could be followed and taught. Looking at the Royal College of Anaesthetists simulation, this is just a snapshot of what they provide. They have a simulation advisory group which oversees all these activities. They meet regularly. They review what's global standards and other, what I've mentioned previously, association standards, and then see if we are online with that. They have produced simulation podcasts, which is very useful. They have simulation scenarios, which I'm going to show you what kind of scenarios they're going to have in the next slide. They have also other simulation resources and support, which is similar to the AAGBI or what I've mentioned previously. And then specifically for trainees, they have produced guidance for simulation-based education in training to map according to the anaesthetic curriculum, which again, we're going to be looking in the next slides. So this is just an example of the simulation scenarios that's been provided by the Royal College of Anaesthetists. So for example, we have a look at the airway scenarios, and is there a video, and it starts with simulation and then later on debrief and learning points. So it's very good at least to watch it, and then they can, any trust or any organization can, anaesthetic department can use the same scenario to do that. Also critical incidences, there's many of them. Obstetrics, pediatrics, transfer, and also a professionalism based one, which is a communication skills. So they're very, very good, all videos. This is what it's mapped against the curriculum. In anaesthetic curriculum in the UK, we have stage 1, starting with the column far, stage 1, stage 2, and stage 3, which is the advanced. In stage 1, the novice skills and drills, for example, it's mapped against the low-key fidelity, whereas when they move into more failed intubation, it could be a proper scenario, high fidelity. So it's a different modality of simulation could be used to enhance the learning and consolidate the curriculum for the junior doctors. Okay, in summary, I just thought to quickly summarize, simulation is an invaluable teaching tool at every aspect of healthcare. Many benefits to the healthcare system, staff and patients, because the safer the well-prepared staff, the safer the patients, and the safer the organization as well. It has different modalities and can work for a small individual person, teams, or even the whole organization. There are limitations in implementation, but we should work together as an international team to learn from each other and to overcome these limitations. Thank you so much for listening to my talk.